started working in the UK this January, so it's been a couple of months since I started working in the UK. So I just wanted to speak about my experience of how I got here and what you guys can do to better your CV and how you can get like a job in the UK and get whatever you want to basically in the UK. So I'll just start sharing my screen if that's all right. So that's me. I'm Aslesha. So basically what I want to talk about is who I am, what I've done so far, what you can do before you graduate, what the GMC process is going to be like, how to do your job applications, so the websites that you can go through, how the application form looks like, how to build your portfolio while you're still in med school, and how to do a bit of interview prep, because I feel like a lot of us went in without that much knowledge on how to do how to prepare for interviews and what you can basically do to maximize your experience. And last but not least, visa application process, which I bet a bunch of you might have to go through. So let me just go through who I am again. I graduated from LF1 last year in 2021. I started working in Stevenage, which is like a small town north of London, this January, and currently I'm working as an SC1 in the surgical field in St. Mary's Hospital, which is in London under Imperial College. So this is basically, I wanted to go into surgery, so I started my surgical training this year, and it's been great so far. I can give you a bit about that towards the end if you guys are interested in it, but let me just start with the presentation to begin with. So what you can do prior to graduating, so you can do your IELTS and your OET or your OET medical version. So these are English language tests, which unfortunately we have to take because we graduated from Czech Republic. So this, so you can do this while you're still in medical school. I would suggest doing it in your final year. You can do it almost anywhere. Like IELTS is there in Czech Republic. I think OET is a bit. You need to go to places to go and do this exam, but IELTS you can do it almost anywhere. The difference is that IELTS is a bit tougher exam, and I know a lot of people who've actually failed a couple of times and had to redo the exam, while OET is a really easier version of doing it. But honestly, I feel like most of us can do IELTS easily, so I would suggest going for that to begin with. You have to do the IELTS academic version. So for GMC, for your GMC registration, you need a minimum of 7 in all sections. So there are a couple of sections such as reading, writing, speaking, and so you need to get a 7 in all and an average of 7.5, which is honestly, it's not that bad. I did mine in India in my December break. So of my final year, I did it in India. You get I don't know how it is like right now, but I had a small break time over there, and that's when I did it. Normally, most of my friends had done it right in the beginning of the year before starting 6th year. So I would suggest doing it around that time. The slots go by really quickly, so try and get a slot as soon as possible. So UK FPO F2 standalone, which is the training program. It's an F2 standalone program because we've done 6 years of medical school. So we're considered to be F1 equivalent. So what you can do is go through this process and go into something called F2 standalone, which is basically the training process, and it gets you straight into the training route. That has a bit of higher requirements. So you need to get 7.5 in all sections. So it's kind of up to you. I did just my normal GMC registration, and I've managed to come here. So it really depends on what route you want to take in, whether you want to get into the training route straight away, or you'd like to experience a bit more like how I want to do. I wanted to experience a bit of medicine, a bit of surgery, a bit of A&E and everything. So I decided to take the non-trainee or the trust route. OET medical, I don't have that much insight about that, unfortunately, but I think it's pretty similar. You need grade B for GMC registration and minimum 400 points in all sections for the UK FPO standalone. So let me just talk about the GMC registration process in brief, because I think it might change for you guys. It really depends on for me, we just come out of COVID, so it was a bit of a different situation as compared to my seniors. I bet it's changed this year as well. I've got a bit of information from the new batch that has just had to do it. So this is what it kind of looks like. So you have something called your primary medical qualification, which is essentially either your diploma, or it could be something called an alternate medical certificate. So your diploma you usually get when you graduate. So it's during the ceremony you actually get that piece of diploma. However, your medical certificate is this alternate medical certificate is something that you get like almost as soon as you're done with your final state exam, depending on what you guys do. You guys are from different universities, but for LF1, it's gynae. So so as soon as you're done with your gynae exam, that's the day you've graduated. That's your official date of graduation. So once you're done with that, you can go to Yitka in the student department, or whoever you have in your student department, and get this diploma ukončitin, which it basically says that you've graduated from this university on this date, your name is so and so, your date of birth is so and so, and it has a bit of like a couple of identification proofs, and it has your diploma number, which is the most important thing that they need for the GMC registration process. So that you will get that piece of paper. Ask for it in English, obviously, because anything that you get for the GMC registration process needs to be translated. So you're going to sit and translate quite a few documents. After you're done with that, you have to start something called the EPIC or ECFMG verification, which is basically what people use for the USMLE. It's this body or this organization that is based in the US that does verification of diplomas and verification of IDs and details. So you essentially make an EPIC account. It's a physician account. It costs about $130. Then they will, you have to scan a bunch of documents, including like your passport, your diploma certificate, like this alternate medical certificate or your diploma, and then you need a picture of yourself. There are some weird specifications, like it has to be on a white background, and you'll figure all of that out when you actually do the EPIC. It's pretty straightforward. And then you will get a virtual phone call from a notary, and they will call you physically and have this notarization process where they essentially ask you to like sign some documents virtually, basically saying that this is me, this is my diploma, I agree, and then you get your EPIC ID, which is something that starts with C and then 2 letters and a couple of numbers, which you will need for your GMC registration form. So the GMC registration form, when I did it, that was last year, it was a paper form. So this paper form was there online. I had to download it, fill it out, scan it, and then send it back to them. So apart from that, you need your identity proof, so valid passport. You need your internship document. So the internship document is basically this document that states what you've done for the past couple of years, so all your, I think the last year of your medical like schooling. So the UK graduates do 5 years of medical school, and we do 6. So the 6th year is counted as our internship year, which is basically equivalent to F1. So you need this document to prove that you're F1. And we graduate with full registration. So once you graduate, you will actually be eligible for GMC full registration. However, people from UK, so the UK graduates, because they've done only 5 years, they're eligible for a half, I think it's called like a half-time graduation or something. I don't know what it is, but basically we get a full registration in the process of doing our 6 years of medical degree. So that's great for us. So you need this internship document to kind of prove that you're eligible for your full GMC registration. Please apply for full GMC registration, because if you don't apply for that, you'll have to do a bunch of portfolio stuff to actually get your full GMC registration, which is another hassle altogether. And you won't be able to prescribe outpatient prescriptions. So I do believe that it's while you're doing the form, you should definitely please take full GMC registration. You need your IELTS, obviously the one that we'd spoken about earlier. So there's a section on professional experience. If you're doing your GMC registration process right after you graduate, which is what I did as well, you basically have to put the date of your graduation and say, I graduated on so-and-so date, and I am currently unemployed because, well, you haven't got a job yet and you literally just graduated. If you graduated a while ago, you have to give the reasons of what you did, why you're unemployed, or what employments you did, or any sort of clinical attachments you would have done in the 5-year period. So if you did like clinical attachments in the UK, definitely put that in. If you had some small employment, like I worked in a dermatology clinic for some time, so I put that in as well. So figure out what suits you the best and do it accordingly. If you have more questions regarding this, you can always message me and I'll help you further down the line. But I know that this is probably not what you're doing right now. You do this towards the end of your 6 years. And then you have to do something called Declaration of Fitness to Practice, which is basically that you're fit, you're mentally fine, even though we might not be, but like, and that you don't have any physical disabilities and all of that. It's just a tick box at the end of the form. You have to pay a total of £156 and scan all your documents again and send it to the email that they've provided. It's a lot of scanning, a lot of translating, it's a lot of all of that, but it will happen towards the end. And this entire process takes a couple of months. So I started the application process late June and I finished it by mid-August. So for me, it took a couple of months, but I think it's been happening a bit quicker now. There also needs to be an identity. I think this has changed over this year, where you need to come to the UK to do your identity check, which I'm not sure whether it's happening or not now, but you will get to know that towards when you actually apply for it. I think it keeps changing every couple of months. So I'm just going to talk briefly about job applications. So there are a couple of websites you should look at for job applications if you're going to do trust grade and not the F2 standalone program. So we have Track Jobs, which is, I think, the most used website at the moment. I think NHS Jobs is going to go away, and Track Jobs is going to be the main source and the main place for applying to the UK for trust positions. There's also BMJ Jobs, which honestly I haven't found too many jobs on it, but always keep your options open. Take a look at that as well. And the search filters that you can go for are F1, FI1, Foundation Year 1. You just have to really try and do a lot of combinations to get what you want or like what you're looking for. You're eligible for FY2, so please apply for it. I applied for an FY2 position. I'll talk about that in detail towards the end, but I think it's worthwhile even searching for that. JCF, or Junior Clinical Fellow, which not too many people look for, is something that's very good because you get a lot of options in that as well. So your application looks something like this. You have like your personal details, so your name, address, phone number, blah, blah, blah. Disclosure of information, which is the fact that, you haven't about your criminal record and all of that sort. So it's just and the Offenders Act. So it's just basic information that you need to tick box. It's not that big of a deal. This is the main application, and this is what I want to talk about in detail. So the main application questions you have are about your training, so your school, your university, the training courses you attended, any proposed further qualifications. So I had started a PhD, so I put that down there. Any professional registration, which if you're graduating, you probably won't have because you're going to be fresh out of medical school, so you don't have any other professional registration. Current job, course, or other activities. The main thing that you would want to focus on is the supporting information, which I'm going to talk about in the next slide. And inter-authority transfers is when you transfer from one place to another. So if you're transferring between jobs, you'd have to put something over there. And finally, a declaration that you agree to the terms and conditions. And references. So I really wanted to speak about the references because you need to have minimum of two references put down for each job application. Now, I put down references who were super busy, even though they were big doctors. They did not have the time to respond to my references, which delayed my induction and which delayed me starting my job massively, like by more than a month. So I would say really put your references like wisely. Don't put, even if you think that, oh yeah, I have like one of the best teachers in their field and I have a UK doctor, which is going to make my application look much better. Honestly, they don't take a look at who your reference is. They just want to make sure that you have good character. So I would suggest putting someone, well, obviously not your friends, but like somebody, any teacher, anatomy teacher, if you're close to, any sort of teacher that you're fairly close to, but who's going to respond to your email, who's going to respond to their emails, because then it becomes a really big problem later on, and then you're just trying to find someone to cover up, and it's a whole different scenario. So please choose your references wisely, and make sure that they're going to respond in time, and ask them beforehand before you actually put them down as your reference. So I would really want to stress on that. So what I wanted to speak about is how to boost your portfolio. This is important, especially for people who require visas, because so for UK nationals and EU nationals, I believe it's a bit more easier. Maybe not EU nationals anymore because of Brexit, but for UK nationals, because they already have the passport, it's easy for them to come and work in the UK. But for me, for example, I'm Indian, so for me it was very difficult because they were very unwilling to give me the visa. It was a big problem for me because I didn't have a visa. So I would say it's important for us to boost up portfolio. So seminars and conferences, there are a lot of conferences happening, a lot of seminars, especially like by UIMS and EFMG and all of these places that do seminars. Please attend them, get all the certificates, keep them and build your portfolio. It's very important while you're still in medical school. So I would urge all first to sixth, even in sixth year, but first to fifth year especially, go for conferences. There are loads of them happening in Prague in English. Go for them, go for national conferences, international conferences if you can. It's a really good idea. It's going to show that you're interested, you're enthusiastic, you are interested in research, which is what everyone really wants to see, is that you're interested in research. Even if you haven't done any concrete research, everyone wants to see that you're interested and that you're showing some enthusiasm and initiative towards research. So conferences are a big plus one. Even while you're like, once you become a doctor, you definitely do have to go for conferences. But while you're a med student, it shows a lot of interest and it shows that you're willing to do work towards your career, which is, I think, very important. So I would suggest going for conferences. Research and audits. Honestly, there are a lot of research opportunities. You just have to ask any teacher. They're all of them and most of them, especially in the physiology, anatomy, biochemistry departments, because they're all basic science departments. There's a lot of research going on. Even if you don't manage clinical research, it's a great idea to get out there and have something related to research on your CV. So please go and ask your teachers, ask anyone. Even doctors are normally involved in research if they're teaching. So just go and have a discussion with them. Say that I'm interested in research. I want some experience. Do you mind if I can tag along and see how your project is going on? I think it's a great idea, and it will really boost your CVs, because I feel like the job that I got right now in Imperial, the main reason they gave it to me was because of my research and my interest in research. So I would really urge you to go into research. It's great. It opens you up to a lot of opportunities. Audits, I know it's not possible in the Czech Republic because we're English speaking students. They're not open to auditing, but I audited my teaching experience. So you could do that as well if you're into teaching, or if you're doing any course or any seminar. Send questionnaires to your students. Ask them, how did you think my teaching was? What do you think I can build on in the future? Is there anything I can change? Is there something that you would like me to add, like any audiovisual effects, any I don't know, props or something more visual? Ask them that and then implement it in your next time that you teach, and that completes the audit loop. So you need to know what an audit is for your interviews as well, which I'll come on to later. But audits are, if you're teaching, I think it's a great idea to audit what you're doing. Or if you're doing any sort of clinical work in the hospital, it's a great idea to audit and try auditing. They didn't allow us while we were in medical school. I hope it changes soon. Internships, honestly, I feel like we don't get that much experience in hospitals in Czech Republic because of our language, but there are some teachers, if you go to them, they will definitely be more than happy and more than willing to take you and like let you shadow them while they're in the hospital. I've done a couple of night shifts in Prague. I've done a lot of cardiovascular surgery because that's the field that I'm interested in. Out of my own interest, I've just gone and spoken to them, and they said, yeah, sure, you can come join us on our ward rounds. You can learn how to do stuff, and they really allow you, especially internal medicine. I've done a lot of cardiology, a lot of A&E rotations in Prague outside. It has to be outside. You have to show interest. So I would really urge you to do all of those internships in Prague itself. If you can't, like for me, I couldn't come to the UK because of COVID. So if you can do it in Prague, it's a great idea. If you can come to UK, in the UK to do your internships, that's even better, because then you'll have NHS experience to show on your portfolio, which is great for you. So try and get into the Swindon clerkships, send emails to any doctor in hospitals. They should, at senior positions, obviously, so consultants, who should be able to help you out and maybe get you to the hospital so that you can actually do some internships over there. Or ask HR departments. I think they're becoming very open. I've seen a lot of my friends doing internships, so it's very much possible to do internships in the UK as well, but you need to show a lot of initiative. Courses, I would really suggest doing your BLS, at least your BLS before coming to the UK, ALS and ATLS, which is ATLS is the trauma and advanced life support, and ALS is advanced life support without the trauma. This happens when you're in the UK and you're a doctor as well. If you have the chance to come and do it in the UK, it's great, but it's a bit expensive. It's like £300 per course, and ATLS is £700. But the BLS happens. I think the Red Cross manages to do a couple of BLS courses, which is great to have on your certificate, on your CV, sorry. If you do ALS courses as well, you can do them online. I found a free ALS course online, and I managed to do that. So you can do that as well. If you're interested in surgical fields, I would urge you to take surgical skill courses. I know there's a surgical society because I'm a part of it, yes. And we do surgical skill courses, which is a great idea. I think you should take that. You should take suturing courses that Medsoc, UIMS, all of them are, I've seen them do a couple of suturing courses as well. It's great because at this point in my career, they've asked me to like close abdomens and open people up and, assisting. You need to know how to use the instruments, and you should have that kind of dexterity with you. So I think it's a great idea to do suturing and surgical skills. And cannulation and blood taking. It's not like Prague, it's not like Czech Republic, where the nurses do cannulation and blood taking. In the UK, it's primarily doctors who do cannulation and blood taking. So I know there are a couple of courses that you can take in for LF1 students in VFN, but you should definitely take all of these courses. Go to nurses, ask them, can I please take blood? Can I please try a few cannulas? I'm not very good at it. And they will be more than happy to let you do it. So you just need to ask, and they will be more than happy to let you do it. So please take these courses and these electives that are there to do the cannulation and blood taking for sure. And suturing and surgical, definitely, if you're into A&E or any sort of surgical field, you're going to use it. So it's a great idea to start now while you're in med school, rather than coming to the stage and trying to be like, oh no, I don't know anything. And they really look down on you when you say that I can't suture. You should be able to suture if you're getting into the surgical field. Teaching experience is always great. I know that there are a lot of opportunities to teach in the UIMS and Medsoc and all of your respective student bodies. It's a great idea to have on your portfolio. It's something that you need to talk about in your supporting section, like supporting information section as well. Please take on teaching roles, get feedback from them, put that in, and it's always good to boost your portfolio. And if you can get into leadership and management roles, that will also be great for your portfolio, because there is if there's no, so sometimes the application form is broken into sections, but if it's not broken into sections, you must talk about all of these while you're putting in your supporting information. So leadership and management is important for you to show initiative and to make sure that you can actually take on responsibility when you're in tough situations. For example, when you have like a dying patient, or you're in A&E recess and somebody's coding and you need to start something, it shows that you can take initiative and you can actually do stuff. So important to take leadership and management roles in, for example, UIMS, Medsoc, and all of these places. Even if it's in a small group of people and it's within your small class, it's important to take these roles. So interview preparation, I'm just going to go briefly about this. So the interview normally is broken down into three sections. You have the general part of the interview, a case-based scenario, and maybe an ethical. So I've done a couple of interviews so far. Mostly they ask me about the general stuff. They ask sometimes about like I said, a scenario. So you have an unwell patient, how do you handle it? And I haven't been asked about any ethical scenario, but I know of people who have been asked about ethical scenarios. So it's always good to know. So general interview questions, you can be asked personal questions such as, run us through your application and tell us about yourself. So it's very important to know about your application, what you've written down, because I've gone I've had a couple of interviews back to back where I got confused as to what I put in on my application. I made it the application a bit specific for the job that I was applying to. So I wasn't very sure about what I wrote through the application, which is not a good sign. So you need to really know your application and kind of understand what you've written about yourself and make sure that you know, because they have it in front of them while they're interviewing you. So you should know it as well. And tell us about yourself. It could be personal experiences, could be professional. I would just say start with, I'm so and so, I graduated from so and so, I'm from so and so, and this is what I've done so far, and this is what I would like to do in the future. That just gives them a big run through and a big general idea of who you are. Then they come on to more technical questions, such as, have you done any audits? Do you know what audits are? Do you know what, have you been involved in any research? Do you know what quips are? So all of these, there are nice YouTube videos online. You can just search it on YouTube and you'll find great videos about what audits are and what the audit loop is, and how to do an audit and all of that. And quips are basically quality improvement projects. So these are small projects that you can take up that would just make the system a bit better. So if you can get involved with quips, I think that would be easier for you at this stage than getting involved in audits. But you have to know what an audit is and what the audit cycle is. It's important to do audits while you're in the NHS. So get familiarized with what they are and how to do one. And if you know what they are and how to do one, it would be good for your interview. And research is what they generally ask me, because I put that in my CV. So I just spoke about my research experience and about the papers that I've published and all of that. So it's this is what I mean by they really want to know whether you're into research and auditing. So situation questions such as, tell us a time where you showed management skills or leadership skills, or about your teaching experiences, or tell us a time where you were in a tough situation and how you came out of it, or tell us a time about a mistake that you made and what you did to rectify it. So these sort of questions keep coming up in interviews. I would say that you should talk, if especially about the mistake and like tough situations, you need to show what you learned from the situation rather than how you are bad, show something that makes you seem like a bad doctor and not trustworthy. So talk about mistakes, talk about how you came out of it and what you learned from them. I think that's the most important thing that they want to know. And they also want to know that you are a safe doctor, that you would always put patient safety first. This is very important to them. I feel I will come to the interview more case-based scenario questions later, but I think what they really want to know is that you put patient safety first. That's very, very important to them. So case-based scenarios, it could be medical, it could be surgical. They're usually acute scenarios. So acutely unwell patient on the board, acutely unwell patient in A&E, post-surgical patient with acute symptoms. It's always something of the sort where you have to do your ATE approach. And this is actually what we do in practice as well. So it's very good to know that your ATE approach very well, because this is what we do in an actual clinical setting as well. So so your ATE approach, you go through airway breathing, circulation, disability, and everything else. The most important thing that you should know about all of this is that you have to intervene at every situation. So if your airway is compromised, you would say that I would ask anesthetics to come in and intubate, because as an F1 or an F2, you are not capable of intubating, obviously. So you would say up to the head tilt, chin lift, try and keep the airway open, and then ask anesthetics to intervene. So it's always about how you would intervene in every situation. With breathing, if their oxygen saturations are low, you want to give them oxygen. So say I'd put them on a non-drip breather mask, 15 liters, and check their oxygen saturations in 5 minutes. Circulation, I want to give them fluids, get an IV line, give them blood, stuff like that. So circulation related could be, it's most likely going to be something so like volume, hemodynamically unstable patients. So it's about fluid and all of that. Disability, you check their abdomen. You do a head-to-toe approach where you just go through primary survey, what we call in trauma, you do a primary survey. Geeky Medics is a great place to look at all of these things. They have medical and surgical scenarios, which you can go through. There's the Oxford Handbook for Foundation Doctors and Clinical Medicine. Honestly, these were great. I keep them with me at all times, and I walk around with them on the ward as well. They're very, very easy and quick to look through. And OscuStop, which I haven't had much of experience, but I've heard that it's great as well. They want to know that you're a safe doctor and that you would escalate when the situation is a bit out of control. So, like I said, you're not going to be able to intubate a patient while you're an F2 doctor or an F1 doctor. So you need to escalate at that situation to anesthetics, or always escalate to your senior registrar or to the consultant on call or anyone if you're not comfortable with the situation. They don't expect you to know all the answers. They don't expect you to do all the anything big, so they won't expect you to actually perform surgery on this patient. They just want to know that you're a safe doctor, that you know the basics, that you can predict what's going to happen, so you're able to diagnose the patient, and that you would escalate it to the appropriate senior management. So this is very important. I would just say that it's always a good idea to escalate situations whenever you're not comfortable. And like I said, patient safety comes first. This is what they want to know. They want to know that you're a safe doctor, not a smart doctor. So always escalate when you feel like it's getting a bit out of hand. And the best way to talk to a senior registrar or anyone senior is the SBAS. You talk about the situation, background, assessment, and recommendations. So, for example, yeah, I have a 25-year-old female coming in with lower quadrant pain, has been vomiting twice since morning. She's also had a couple episodes of diarrhea. I've done an abdominal examination on her. She seems to be tender around the McBurney's point with rebound tenderness. I think it's appendicitis. I would like you to come and take a look. This is a basic thing, what I deal with every day. So this is something that you would want to kind of practice with. So I would suggest when you're doing these case-based scenarios, you take a friend and just go through it with them, see how they would respond to the situation, how you would respond to the situation, if there are any differences, and you can always ask one of us, like one of our seniors, what we think about it, and we can always help you with that. So it's a good idea to just run through these things with somebody so that you get an idea of how to speak these things out with someone, and you will always learn something more from a friend or from someone when you talk about situations like these. Ethical scenarios. I haven't had any ethical scenarios in the interviews that I've given, but you can get ethical scenarios in your interview as well, which is like, you smell alcohol on one of your colleagues' breath. What do you do about it? You see that someone is giving an incorrect dose of heparin. What do you do about it? And stuff like that, basically. So again, patient safety always comes first. So if you have a colleague who is drinking alcohol and decides to come and practice medicine, the first thing that you would do is to take this colleague of yours to the side in a separate, secluded area and discuss what problems they possibly have, and ask them to take the day off, considering that they've been drinking alcohol, and that you would want them to come back in fresh and more rejuvenated tomorrow. If they don't respond well, then you would have to escalate it to a senior member of staff. Again, patient safety always comes first, so you wouldn't want someone who is drinking alcohol to be practicing medicine. So that's something that you have to think about. But ethical scenarios are a bit of a hit and miss, where you have to kind of gauge the situation and see how you would respond. But the whole thing that they want to know again is that patient safety and confidentiality always comes first. Okay, I just want to speak about the visa application process, because this is something that I found a bit daunting, and I bet a lot of you are worried about this as well. So this is for all the non-EU as well as EU, so basically non-UK nationals. You would probably need to do your visa application process. So the visa application process takes about 3 weeks. The main thing that you need is the certificate of sponsorship. So once you do get the job, they will give you something called the certificate of sponsorship, which contains a lot of things, including like a reference code, your job title, annual salary, occupation code, name of the employers, and they have like a license number, so it's the sponsor license number. You need your IELTS certificate. So the academic IELTS that you would give for your GMC registration is valid for your for your visa application as well. So that turns out great. You don't have to give a separate IELTS. It's the same one. You need your valid passport as well as a blank page on your passport for them to stamp it. You need your criminal record, which for me was a bit of an issue getting. Let me explain why. So you need to get one from Czech Republic, which needs to be translated. And this was easy to get because there's one of the places I've forgotten now, where you can just go, especially for people who have an LTR, so your long-term residency permit, and you get it within minutes. I believe so EU nationals as well as UK nationals, for you guys will take a bit longer because you're not registered with the Czech government. So it would take a bit longer for you to do this. I would suggest doing this well in advance. So before your last state exam, definitely go and get this thing sorted. You need a copy of your birth certificate. So keep that handy, and it would take about 20 days. But for people with a long-term residency permit, for example, like me, I'm an Indian national, so it was very easy. I got it within minutes. You have to pay 100 crowns there in cash, and you get it within the same day. It's the second point that's where it was a bit messed up for me, because I stayed in India for a total of more than 12 months after I turned 18, which included my summer vacation. So a couple of summers here and there accounted for 12 months. And I needed to get another police clearance certificate from India, which took a very, very long time, which delayed my visa process. So if you do need a police clearance certificate from where you are originally from, considering you've stayed in that country for longer than 12 months, you should go to the embassy and you can apply for it from there. It takes a while, so I would suggest go earlier and ask them to give it to you in English, because then you need to translate it. So any document that's not in English needs to be translated. So you need to get that translated if it's not in English. That was the biggest issue for me. And if you're over 28, you have to get a certificate, police clearance certificate from any country you stayed over. So hopefully you'll be applying for your GMC registration before you turn 28, and that'll make it a lot easier. Evidence of personal savings. So you need to have at least 1,270 pounds available in your bank account, which has to be stagnant for 28 days. So that means there cannot be any influx or outflux. I mean, influx is great, but you shouldn't be spending the 1,270 pounds for 28 days before you get the bank statement from your bank. It's just weird, but that's how it is. Some trusts can also sponsor you nowadays, so that when you're applying for a job, and if you do get the job, and they're ready to give you the certificate of sponsorship, please ask them if they can tick the box saying that my trust is going to sponsor for me. It doesn't mean that they will pay for your accommodation and all of that. You might need to still pay for it, but it just makes your process a little easier rather than having the 1,300 pounds in your bank account. That's a bit of a pain. You would need to pay 247 pounds for your application process, which is relatively cheaper compared to what I paid, because I expedited the whole process and it got done within a day. So, within a week, sorry. So that was pretty easy for me. I would just say try and get this done as soon as possible. It's a bit of a pain. Additional documents you may need include your vaccination certificate. So because I'm again Indian, I had to show that I had the BCG vaccine. Please keep a vaccination record handy. That would be helpful even once you get the job, to show them that you have your Hep B vaccine, your MMR, all of that. It would be helpful to just keep that handy. Travel history, it is a part of the application process. It took me forever to do this. They literally want to know every place that you've entered and exited. So all the stamps that are there on your passport, they want to know where you've walked in and walked out. So I just made a spreadsheet beforehand, before I even applied for the visa, and just copy pasted it onto my application, which made it a lot easier. Keep a proof of your Czech Republic visa, so your LTR, get that photocopied and keep a copy of that and submit it to the visa place, because they want to know that you're a valid citizen of Czech Republic. Also, I gave in my Czech rental agreement to show that I actually am living in the Czech Republic, and I'm not just having a visa. The appointment is at TLS Contact in Prague. I don't know about if it's there in any other place, but it's very close to Stepanska, the tram stop. It's just like a few minutes walk from there. So what I did was I wanted to apply for an expedited process. I managed to get a walk-in appointment, but I had to pay a lot of money. I would suggest not doing that. I would suggest trying to get an appointment beforehand, but the appointments are only on Wednesdays and there are not many appointments available. So you have to kind of see all of this in advance and make sure that you have an appointment. But if you're desperate, you can do what I did and just walk in, pay a shit ton of money, and then they'll let you do your visa application. You give your biometric that day. You can upload the documents yourself, or you can pay them to upload your documents. Honestly, it doesn't make a difference. I would say upload your documents yourself, saves you a lot of money. And yeah, that's about it. Do you have any questions? I will just stop sharing and yeah.
Hi, I had a quick question. Thank you so much for the presentation, by the way. In terms of, okay, for example, if you've had like a lot of teaching or you've had like a lot of conferences, a lot of experience, I understand obviously that it's good to keep the proof, especially for certificates, but at any point, do they actually ask for the proof? Like in terms of like, like the audit and stuff like that, for example, do they say like, oh, can we see like what's actually been said or something like that?
So for trust grade positions, the way that I showed the track application jobs and stuff, they don't actually ask for any proof, but you will want to get into training at some point in your career where all of that is accountable. Like you need to show proof of all of these documents. So not for your immediate getting into the NHS, but for your long term, it's a good idea to have this proof. Yeah.
On hand. All right, got it. Thanks.
Anyone else? I see some questions in the chat. So for under 28, the 12 months don't need to be consecutive. It could be across 10 years. That's where the problem was. So every vacation you take home counts as the number of months. So I had maybe 5 3-month vacations at home and a couple of months before I came to Prague. So that counted. So I needed a police clearance from India. Any other questions? Okay, the link for the free, I have to dig through my emails, but I will try and find it and I'll send it across. Yeah. Okay. I mean, they could be in Czech language. Of course, they could. If you understand Czech well, very good for you. Definitely go for any conferences. It just really shows that you're interested and that you were doing stuff during your med school and not just studying. So I would say go for them as well. I don't understand that much Czech, so I wouldn't go for it. But go ahead. That would be great. Any more questions?
All right then, guys. If we have no more questions, thank you very much for attending today. What I will do now. Oh, we have one more question? Okay, go for it.
When is the perfect time to start? What process? Sorry. If you're talking about GMC process, it's the whole procedure. Oh, okay. So I would say all the conferences, seminar, teaching, anything to build your portfolio, you should start at any time in your medical. Like I think you should start now. Now is the great time to start. And if you're talking about GMC, so GMC process, you should start as soon as you graduate. So literally as soon as you graduate, walk up to the study department and get yourself. Oh, from what? You're in medical school. If you're in first year, start now. If you're in second year, start now. Third year, start now. Every year, it's a good time to start. We don't need plabs, no. After Brexit, this all changed. We don't need plab at all. We can just go straight into get into the system. I taught as a TA a year ago, but didn't ask for feedback. No, you can definitely still ask your old group. I didn't do it either. I realized in my 6th year that I probably should do that. I think it's a good, just if you have a group chat with your earlier group, just ask them if they'd be happy to fill the form. Even if you get a couple of responses, that's good enough. What about the UKMLA? I haven't heard about the UKMLA so far. I
think the UKMLA is going to start in 2024. this is based off what I just heard. And the first year it's going to be a preliminary year, so they're just doing a pilot. So basically, even if you fail, it's not really going to matter. But from 2025, that's when it's going to start to count.
Yeah, I heard 23 while I was graduating. I think they're just gonna, the UK is not a very reliable, like they don't do stuff reliably. So I would just wait till you actually get some information. As a non-Europe passport, hold on, I'll ask.
Are you getting these messages
Directly.
Okay.
Yeah, I'm getting it. That's the problem. Maybe if you post it on the chat, everyone can see for the next person. But so I got it. I got the job in October. There are a lot of periods. So it basically happens with each rotation switch. But there are a lot of jobs that are available at all times. So it is possible. You just have to be a bit persistent. Don't give up. I gave around like 60 applications, and I got one interview, and I got the job. So honestly, you need to just keep applying and persevere, because it is very disheartening to see you get 59 rejection emails, but then when you do get the 60th one, it just changes your life. So honestly, just keep going, don't stop applying. And especially for your interviews, you need to be a bit confident. Like if you're not confident enough, they're not going to take you anyway. So be confident while giving your interviews. How are training jobs different from non-training? So training jobs are basically you get into the actual specialization system. So you're getting into the training pathway, which is going to take you to be a consultant later on. It's a more direct route to get to a consultant. The non-training jobs, it's more difficult to become a consultant with non-training jobs. That's why almost everyone goes into training sooner or later. I'm doing a non-training job at the moment because I wanted to experience surgery before actually getting into the training pathway to make sure that I'm doing the right thing. So that's why I chose the non-training pathway. But as IMGs, we normally get the non-training first, and then we make our way into the training, if that makes sense. Yes, so I did stay in the Czech Republic after graduating because I started a PhD. So I got another student visa and I managed to stay in the Czech Republic. But there is something called, I should have put that in my presentation. I'll edit it and send it back to you if that's okay, Shah. But it's something called a job seeking visa. So you can apply for the job seeking visa, which gives you 9 months of visa after you're done with your with the current visa that you're holding. So you can stay in the Czech Republic for 9 more months after you graduate with the job seeking visa. I did a student visa because I applied for a PhD, but you can apply for this job seeking visa. Do self audits like teaching, etc. count as the same as clinical audits? So it's not the same, obviously. Like you're doing clinical auditing is much more relevant to the NHS, so that would make a lot more difference. But if you do a self audit, it shows that you understand what an audit is, which is what they also want to see. They're not actually looking at what reform you've done. They want to know what you understand about the whole auditing process rather than the actual audit that you've done, if that makes sense. So FY2 standalone salary is the same as an FY2. So if you see an FY2 salary, it should be the same. I joined as a JCF actually. Sorry, I made a mistake. I joined as a junior clinical fellow. So my salary was a lot more than my colleagues. I was making 33,000 per annum in my first couple of months, which has now increased since. So and I don't know how much an FY2 makes, but as a JCF, it's 33,000. Okay, would you recommend going for FY2 instead of FY1? I would recommend going into FY1, honestly, because the jump for me was very, very drastic. I went from not doing anything to being in a COVID ward and with patients on NIVs and invasive ventilation and stuff like that. Same way I jumped from FY2 to SD1 very quickly, which is basically I have to do surgeries on my own, which is a bit scary. I would suggest going through FY1 to begin with so that you can you're at pace with all the UK graduates, because FY2 does have certain responsibilities that are more than FY1. So if you're in FY2, you have to look after the FY1s. So it's a good idea to start with them, because we don't know blood drawing. We don't know how to do all of these things. We're not taught that well. We don't know how the system works, which is different in each hospital. So I would suggest starting with FY1. But starting with FY2, if you do get it, is completely doable. You will cry for the first couple of months. And you will be tortured, and it will be daunting, but it's completely doable. Just you have to believe in yourself. I feel like you just need to give yourself a bit of a push and be like, I can do it, and while the tears are coming down. Would I recommend job seeking visa or going back to India? So when I was applying for the jobs, COVID was still a thing. So I didn't want to come back to India and apply because I was scared that I wasn't going to get the visa from India, and that would just worsen my chances. But I think it's up to you. When I come back home, I get very complacent and I don't do anything. So I chose to stay in Prague. I worked in a dermatology clinic. I worked on my PhD, and I did a lot of other stuff just to build my portfolio. So that's why I wanted to stay. It really depends on you. I think right at this point, doesn't matter where you apply from, you're going to get the visa. So it actually just depends on you how you want to take this. I knew I was going to become very complacent once I came back, so I didn't want to take the risk. How long after graduating? I graduated in June and I got the job in October. It took a couple of months, but I got there eventually. Do you recommend working in the Czech Republic or any other country, like apply for residency program? So if you're going to work in any other country, including Czech Republic, you need to do a language test. So that again is personal choice. It's up to you. I personally did not want to learn Czech and go through the harrowing process of giving the B1, B2, C1 exams, nor did I want to learn German and do the same. So I just waited and did clinical and research work in the process. In the meantime, but it's really up to you. It's personal decision. It's just that if you do work a full-time job, you're not going to be able to focus on doing your applications for the UK because they are time-consuming. It's really up to you. Honestly, I don't want to give you any advice regarding that, but see how you feel. If it's too much, you can always quit. And if your Czech is strong, go for it. Any other questions? Okay, I don't see any questions.
Okay, if there's no more questions, I'm gonna stop the record.